Welcome to the Global Men's Wellness Podcast.
Great to be here.
Today, we're getting into a really critical topic. It affects men's health, sexual function, quality of life, basically the whole picture. We're talking about sexually transmitted infections, STIs. We hear a lot about them, but we want to look at the latest guidance from the CDC.
Yeah, cut through some of the noise.
Exactly. Give you a clear understanding of the facts from the most recent treatment guidelines, help you stay informed, proactive, especially around how these things impact, urological health long term.
And that's such a vital angle because I think one of the biggest challenges with STIs is how hidden they often are.
Hidden? How so?
Well, many of them, think chlamydia, gonorrhea, they often show absolutely no symptoms.
Really? No symptoms at all?
Often, yes. Especially if the infection isn't genital, say in the throat or the rectum.
Okay.
So someone can be infected, they can potentially pass it on and have no idea. It makes detection and prevention, too, really quite complex.
Right, so you wouldn't necessarily know. That's a huge hurdle for men's health. But, okay, when symptoms do show up, what are we generally talking about? What are the main infections causing trouble?
So when men do get symptoms, a common one is urethritis. That's inflammation of the urethra.
Causing things like painful urination, discharge.
Exactly that. And the main culprits are often the ones people know. Neisseria gonorrhea, that's gonorrhea, and chlamydia trachomatis, pretty common.
Okay, the usual suspects.
And this is really crucial, there's another player that's often missed. Mycoplasma genitalium.
Mycoplasma genitalium. Okay, tell me about that one.
Well, it's actually a pretty significant cause of urethritis that isn't gonorrhea, what we call non-gonococcal urethritis, or AGU.
Yeah.
We're talking maybe 15% to 25% of NGU cases in the U.S.
Wow, that's quite a chunk.
It is. And prevalence varies elsewhere, too.
Yeah.
The key thing is, if you ignore these infections, any of them really, they can lead to some serious complications down the line.
Like what kind of complications?
For men, things like epididymitis, that's painful inflammation in the tube at the back of the testicle.
Ouch.
Yeah. And prostatitis, inflammation of the prostate. These directly impact your urological health, potentially causing chronic issues.
That really drives home why early detection, even without symptoms, is so important. Are there other, maybe less common bacteria involved in urethritis too?
Yes, definitely. Less often you might see things like Haemophilus influenza or parainfluenza, even certain Corynebacterium species.
So it's not always straightforward.
Not at all. It really highlights why healthcare providers need a thorough approach. Look beyond just the top 2 or 3 possibilities.
Makes sense. So given this hidden nature, this complexity, how should doctors and patients too approach this? How do you start getting a clear picture?
It really has to start with a good communication. Open, honest conversation in the clinic. There's a recommended framework called the 5 Ps. It helps structure the conversation in a non-judgmental way.
The 5 Ps, what are they?
It stands for partners, who your sexual partners are. Practices, what kind of sex you're having. Protection, how you protect yourself from STIs. Past history, have you had STIs before? And pregnancy intention.
Okay, that covers a lot of ground.
It does. And it's essential for figuring out risk, both behavioral and biological, and making sure the care plan fits the individual. That conversation is really the foundation.
So once you've had that talk, what about the actual testing? Has that gotten any easier or, more accurate?
Oh, definitely. Testing has advanced quite a bit. The go-to method now for chlamydia and gonorrhea are these things called nucleic acid amplification tests, or NOTCs.
NOTs. Okay.
For men, often the best sample is just urine, which is much easier and less invasive than older methods like swabs inside the urethra.
That's a big improvement.
Absolutely. And these knots are incredibly sensitive. They can find even tiny amounts of the bacteria or virus. Plus, and this is a really big deal for catching those silent infections we talked about.
Yeah.
You can now do self-collected swabs for the throat and rectum.
So you can collect the sample yourself.
Exactly. And studies show these self-collected samples are just as good, just as accurate as ones collected by a clinician. It makes people more comfortable testing those sites where infections often hide without symptoms.
That sounds like a game changer for getting more people tested properly. What about testing for that other one you mentioned, Mycoplasma genitalium?
Good question. For M. genitalium, testing is specifically recommended if a man has urethritis symptoms that just won't go away or keep coming back. It helps pinpoint that specific cause.
So it's targeted.
Right. And another one, Trichomonas vaginalis, people sometimes think of it mainly affecting women, but men get it too. Testing for that might be considered if you're in an area where it's very common or if you know a partner has it.
Okay, so testing is getting smarter, more targeted. Now, let's talk prevention, because obviously avoiding infection in the first place is ideal. What's the core advice there?
Prevention is absolutely fundamental, and barrier methods are key. Latex condoms are very effective. And for people with latex allergies, synthetic ones like polyurethane condoms work well too. They protect against STIs, HIV, and pregnancy. They're pretty robust.
Good options, but isn't there a catch with some types of condoms? Something people might not realize?
Yes, and this is critical. Natural membrane condoms, sometimes called lambskin, are not recommended for STI or HIV prevention.
Oh, why not?
They actually have tiny pores, large enough for viruses like HIV or hepatitis B to pass right through.
Wow, okay, so they might prevent pregnancy, but not viruses.
Correct. Zero viral protection. Also, spermicides, especially those with nonoxynol 9, they shouldn't be relied on for STI or HIV prevention either.
Why is that?
Well, research actually suggests nonoxynol 9 can irritate tissues and potentially increase the risk of getting HIV. And for women, it can increase the risk of bacterial UTIs.
So counterproductive almost.
In that context, yes. And it's worth remembering, hormonal contraceptives, things like that, great for preventing pregnancy, but zero protection against STIs.
Crucial distinctions. So beyond barriers, what else is part of the prevention conversation?
Well, counseling still plays a big role. Talking about abstinence, talking about mutual monogamy with an uninfected partner, these remain important parts of a comprehensive prevention strategy. It's about discussing all the options.
Makes sense. Now, the guidelines also point out that some groups face, well, much higher risks. Men who have sex with men, or MSM, come up specifically.
Yes, unfortunately, MSM carry a disproportionately high burden of HIV infection. The difference in lifetime risk is quite stark.
How stark?
Estimates suggest a lifetime risk of HIV for MSM is around 1 in 6. Compare that to heterosexual men, where it's estimated around 1 in 524.
1 in 6 versus 1 in over 500, that's huge.
It is. And tragically, there are significant racial and ethnic disparities within that. For Black or African American MSM, the lifetime risk is estimated at 1 in 2. For Hispanic or Latino MSM, it's 1 in 4.
Those numbers are staggering. It really highlights major health equity issues. What drives that higher risk?
Several things contribute. First, HIV just transmits more efficiently through receptive anal sex compared to vaginal sex.
Okay.
Then there are other factors like potentially having more partners, maybe anonymous partners, condomless sex, sometimes substance use can play a role, and crucially having another STI like chlamydia or gonorrhea significantly increases your susceptibility to HIV.
Right, makes the body more vulnerable.
Exactly, which makes screening even more vital for this group.
So what are the specific screening recommendations for MSM then? Especially thinking about those asymptomatic infections.
Because of the higher risk and the silent nature of many infections, routine and frequent screening is key. The ideal recommendation is screening every 3 months.
Every 3 months.
Yes. And that includes testing those extragenital sites, throat and rectum, because that's often where infections hide without symptoms.
Got it. What about pre-P, pre-exposure prophylaxis?
Pre-P is a fantastic tool, highly effective for preventing HIV for those at substantial risk. But importantly, using pre-P doesn't mean you stop STI screening.
Because it only protects against HIV.
Precisely. You still need regular screening for things like gonorrhea, chlamydia, syphilis.
Okay. And are there other things like vaccinations specifically recommended for MSM?
Yes, HPV vaccination is important. It's recommended for all men, including MSM, up through age 26. It helps prevent things like genital warts, but also certain cancers, like anal cancer.
And speaking of anal cancer, any specific screening for that?
Routine anal cytology, like a pap test for the anus, isn't universally recommended right now, mainly due to lack of enough data showing clear benefit outweighs potential harms or costs. However, an annual digital anorectal exam, that's a physical exam by a clinician, is suggested for people with HIV and for MSM who've had receptive anal intercourse. It's looking for any early signs.
So it's a very comprehensive approach. And it seems like it extends beyond just the individual patient. Tell me about partner services. What does that involve?
Partner services are really a public health cornerstone. It's about reaching out to the sexual partners of someone diagnosed with an STI.
How does that work?
It involves helping the patient notify their partners and then offering those partners evaluation, counseling, testing, and treatment.
Why is that step so critical?
2 main reasons. First, it prevents the original patient from getting reinfected by an untreated partner. Second, and this is huge from a public health view, It helps stop ongoing transmission within sexual networks, breaking the chain.
Breaking the chain, right. And there's a specific method to help get partners treated quickly, something called EPT.
That's right, expedited partner therapy, or EPT. In some situations, the healthcare provider can give the patient medication or prescription to directly give to their partner or partners.
Without the partner needing a full clinic visit first.
Exactly. It helps overcome barriers like scheduling difficulties or reluctance to seek care, ensuring faster treatment. But it's important to note, the evidence for how well EPT works, specifically among MSM, is still a bit limited.
So it requires a conversation.
Definitely. It needs shared decision-making between the provider and the patient about whether it's the right approach in their specific situation.
It's really interesting how taking STIs seriously, including things like partner services, feeds back into this broader idea of men's wellness.
Absolutely. If you think about it, proactively dealing with STIs does so much more than just treat an infection. It lowers your risk of those painful, long-term urological problems like epididymitis and prostatitis we mentioned.
Right, the physical side.
Yeah. But also, it supports mental well-being. There's often a lot of anxiety, sometimes stigma tied to STIs. Addressing them openly helps reduce that. And ultimately, it promotes better sexual health overall, not just for you, but for the community, too. It's all interconnected.
It really is. This whole discussion, looking at the CDC's guidelines, just highlights how complex STIs are in men, but also how crucial it is to understand them. From realizing many are asymptomatic to knowing about the latest tests, the right prevention methods, the specific risks for certain groups, it shows that being informed gives you power.
Knowledge really is power here.
And what really strikes me is just how deeply your sexual health is tied to everything else, your physical health, your mental health. It's not separate.
Not at all. It's a core part of overall well-being.
So as we wrap up, maybe the question for everyone listening is this. How can you use what you've heard today? How can you maybe talk more openly about sexual health, make sure you're using the right prevention consistently, and advocate for the screening you need, not just for yourself, but maybe encouraging others too? Something to think about.